want you just to look out into kind of the back of the room. Yeah, that's great. I just want you just to, yes. And then Becca, I want you to look at the tip of this, and I want you just to follow it. You can see some nystagmus. And then I'll just have you look just straight to the back. And then we'll just keep the camera on there. And you'll see these sudden darting movements, right? That's what we call nystagmus. When you become a neurologist, supposedly your significant other is supposed to make you this optokinetic nystagmus tape. And it's to follow, it's like following a train. So as you see a train going by, there's a slow component and there's a fast component to correct. So those are all very important movements that we look at. So I'm going to try not getting away too much. And so she has actually normal, where she has that, but in addition to that, she has that nystagmus. So certain parts actually work quite well, not a problem. And then we'll just have you up and go along. You can see how the nystagmus goes up there. So it's very important for those movements because different parts of the brain tell you, okay, look up, look down, look to the sides. I want you to put one of these on the stick. And I haven't had my third cup of coffee too, so it's probably me. So I want you to put your hands straight up. And I want you to close your eyes. And she becomes a little more unsteady with her eyes closed compared to eyes open. Okay. Now I want you to take that finger, touch your nose, touch my finger, back in. Now we're belly. Check, make sure I check knees. Okay. So I'm going to come down here and look at Becca's knees. In somebody Becca's age, the reflexes should be very easy to get and having difficulty getting. Okay. And interestingly, when you get that, it's almost a dud type feeling. But that's not specific for this condition. You could see that with a neuropathy. You can see that with somebody with Guillain-Barré syndrome, for example. And if I come down here, it's the same thing. The hammer just kind of bounces off and doesn't give the normal response. Can I take your shoes off? So this is just a tongue blade, and I'm just going to break it. It's a little bit sharp. Sharp? Sorry. And there? Sharp? Okay, let me do this a little harder. No.
So I'm going to just kind of pretend that we've already cleared the chest, cleared the upper arm area, and demonstrate the light skin tractioning massage on the forearm here. So if I were trying to clear the forearm, I would be working proximally to distally. And you just lay your hand over the extremity, try to get a lot of contact area, but very little pressure. And then once you've done that, you just traction the skin distally, kind of come across, and then let it retract proximally. So you're doing kind of a U shape. And you would do 5 of those light skin tractioning U's right in a row as you clear. First you're going to do about the proximal third of this segment, the segment here being the forearm. And then you'll move to the middle and do 5 more in the middle of that segment. And then move distally and do 5 more on the distal part of that segment. Again, I'm just trying to get a lot of contact area with my hand on this extremity, but very little pressure, just enough so that I actually will traction the skin instead of slide over it. So now I have cleared the forearm, and I could clear the forearm on the back as well. And then the next thing I might do is to try to flow that edema through the lymphatic system proximally. When you do your flowing skin tractioning massage, it's basically the same technique Just get a lot of contact area, very little pressure, and you do the little U, and then you'll move to the middle, and then proximally up the arm, across the chest, and you'll do that flow 5 times. The other technique I want to demonstrate with manual edema mobilization is the pump point stimulation. This is done in areas where the lymph tends to slow down a little bit, typically around lymph nodes. And so like there's lymph nodes in the medial elbow, and so for the pump point stimulation, you're going to lay your hand on that, and typically we'll do both sides at once with pump point stimulation. You're going to do that same skin traction and massage with maybe just a little bit more pressure over the pump points, and you'll do a lot more repetitions, maybe 20 or 30 repetitions over the pump points. You can do that after you've cleared and flowed, or you can do that between clearing and flowing, but that's just there to try to stimulate a little bit quicker flow through those areas where the lymph tends to otherwise slow down a little bit.
I'm going to start off. I'm just going to inspect the upper body. I'm looking at your skin. I'm looking to see if there's any masses or lesions. Are there any that you are aware of currently?
No.
All right. Let me just look at your arms. Your skin is warm and dry. You have a tan skin color. Your nail beds are nice and pink. The cap refill is less than 2 seconds. There's no evidence of clubbing of the fingers. There you go. You can relax your hand. All right. Your skin is a little loose. That is normal with age. I'm going to go on and look at your face now. Your scalp it's a little dry, but there's no flaking. You have a normal distribution of hair, facial hair. The ears and the eyes are both symmetric on either side of the face. Your eyebrows are symmetrical. Your nose and mouth are midline. Your lips are pink, a little dry. I'm going to put my gloves on now. Just want to take a closer look at your eyes. If you'll just open your eyes, I'm just going to pull down slightly. Conjunctiva are nice and pink, and your sclera are white. Just the eyes are not dry; they're clear drainage, but not excessive. Can you open and shut your mouth for me? Very good. I don't feel any clicking. Do you have any pain when you open your jaw? And can you clench down? Very good. Just gonna look at your ears. Any pain or tenderness in your ears? All right, and check the tragus. Any pain or tenderness here?
Nope.
Very good. Gonna look at your nose. And the nares are symmetrical. Any trouble breathing in or out?
Nope.
Good. And this side?
Nope.
Very good. I'd like to look inside of your mouth. Get my light. Just stick out your tongue for me. Good. And say ah. All right. The uvula rises. It is midline. The hard and soft palate are intact. The buccal mucosa is pink and moist. Your tongue is pink and moist. Can you raise your tongue? Good. And I don't see any masses or lesions there. Let me look at your teeth again. All the teeth are present. There's a few fillings in the upper left and right molars. Have you had any dental pain?
No.
Good. I just want to look at your throat. Your trachea is midline. I'll have you turn forwards for a second. And just swallow for me. Good. Any pain with swallowing?
No.
All right. The thyroid gland feels normal size and dimensions. I don't feel any enlargement there. All right. And turn towards me again. I'm just going to palpate your lymph nodes. Just let me know if you feel any pain or tenderness. Very good. All right, any pain or tenderness in any of those locations?
Nope.
All right, let me just palpate the lymph nodes under your arms. Okay, and in the groin. All right, any pain or tenderness there? All right, that all looks good. Just gonna further examine your eyes. I'm just gonna check your pupillary light reflex. I'm gonna cover this side. Very good. All right, pupil size is about a 4, constricting down to about a 3. They constrict evenly with the light. I'd like for you to look at the end of my pen, just focus on the end of it. And when I move this pen away, I just want you to focus on an object on the opposite wall. Very good. Eyes are accommodating. Now I would like for you to look at the end of the pen, and without moving your head, just your eyes, just move with the pen. Very good. And what I'm doing are all cranial nerve tests. I'm just making sure they are all intact. Can you also stick your tongue out for me and move it from side to side? Go. And up and down. Good. Also, I wanted to check your tonsils. I forgot to do that. Open wide. Good. Yep. Tonsils are present, but they are not red or they're not enlarged. Also, I want to check your trapezius muscle strength. Just pull, raise up with your shoulders. Good, nice and strong. Also, frown for me. Good. And then raise and lower your eyebrows. Good. All your cranial nerves are intact. One last test. I just want to test the sensation. If I can have your forearm. This is a dull object. This is a soft object. And then this is a sharp object. I'm going to have you close your eyes. You'll feel this on your face, and I just want you to tell me if you feel sharp, dull, or soft.
Sharp.
Okay.
Soft. Dull. Soft. Sharp. Dull.
All right, very good. I'm now going to move on to assessing your lungs. Have you had any shortness of breath recently?
Sometimes.
Sometimes. Is it worse with activity?
Yes.
Yes. I did see that you have some mild emphysema, so that could be normal. I'm going to have you face the wall. I'm just looking at chest expansion. Your AP diameter is 2 to 1, which is the normal ratio. I don't see any issues there. I'm going to see if your chest expansion is symmetrical, so take a deep breath for me. And again. All right, very good. That looks fine. I'm not going to listen to your lung fields. When you feel the stethoscope, just take a large breath for me. a little diminished in your bases. That can be normal with emphysema. You're not going to feel me percuss, and I'm just checking to see if it's a normal lung sound with percussion. To the side. All right, and I'm going to check for CVA tenderness. Any pain here
No.
or here?
Nope.
All right. I noted a little bit of hyperresonance in the lung fields, and that is also common with emphysema. But otherwise, I didn't find anything abnormal there.
Okay.
I'll have you turn back around. And come to this side. You face forward. I'm now going to just listen to your heart. I just want to feel the heart. And I am able to palpate the apical impulse. And I don't see any jugular vein distension on either side. I'm going to listen to your heart fields twice, once with the diaphragm and once with the bell. All right, and again with the bell. All right, and then I want to listen to your carotid pulse. Heart sounds are nice and even. I don't hear any irregularities, and I didn't hear any bruits as well. All right, and now I want to listen to your apical pulse and assess it with your radial pulse. And they both feel regular and are beating in unison. I just want to finish up by listening or palpating the rest of your pulses. Turn towards me slightly. And start with your brachial pulses. Strong, radial, and femoral. Okay, and I'll have this side. I'll check behind your tibia. And on top of your foot, the pedal pulse. Just check your cap refill. It is less than 2 seconds. Excuse me. And behind this knee. And the pedal pulse again. And the cap refill is also less than 2 seconds. Well, do you have any questions for me today about your exam?
No, ma'am.
All right. The doctor is going to be in with you shortly. Thank you.
Thanks.